Welcome, everyone. We're looking at Title III of the POPULIST Act. Now, if you're not familiar, the POPULIST Act, which literally stands for the Partnership of Ordinary People Undermining Lobbyist Influence for Societal Transformation, is this massive legislative package proposing a complete upgrade to America's operating system. Today, though, we're focusing squarely on Title III. This section aims to fundamentally restructure the American healthcare system from the ground up, basically transforming it into a patient-centered public guarantee.
But to really understand this legislation, we first need to look at the overarching framework it's built on, and that's the concept of a jubilee. Across human history, a jubilee is essentially this cyclical time of release, repair, and return. It's a season for forgiving debts, restoring liberty, and rebalancing a society that's become a bit too captive to systems that just don't serve the public good anymore. Title III takes this really powerful jubilee principle and applies it directly to healthcare. It frames these specific reforms as a way to gently release Americans from the very real fear that getting sick is going to lead to bankruptcy, delay, denial, or even abandonment.
Okay, let's dive into this. To make this massive package a bit more approachable, we're breaking it down into 5 logical pieces. First, a jubilee for healthcare. Second, releasing the debt burden. Third, breaking up healthcare monopolies. Fourth, transitioning to Medicare for all. And finally, expanding the medical workforce. Section 1. A jubilee for healthcare, a system stacked against us. Reality check. The U.S. spends more per person on healthcare than literally any other industrialized nation, and yet millions of people still remain uninsured or underinsured. Think about it for a second. Medical needs are urgent, right? But patients can't meaningfully shop for care because the prices are completely hidden. It's kind of like grocery shopping blindfolded and then getting the bill a month later. Prices just keep rising faster than wages, networks are highly restrictive, and the billing is deliberately confusing. This whole environment creates immense anxiety. Honestly, the dread of high costs, hidden billing surprises, and crippling medical debt often outweighs the illness itself.
Which brings us to a really fundamental question the Act asks of our current system. Why should getting sick mean going bankrupt? Medical debt leads to something like 500,000 bankruptcies each year in the United States. Should a family's financial stability really be destroyed simply because they had a child, survived a medical emergency, or just needed high-priced care? Keep that question in mind as we transition over to the proposed legislative solutions.
Section 2. Releasing the debt burden. Immediate medical relief.
So how does the Act stabilize access right away? Well, first off, the Act actually restores cuts to Medicaid coverage, including retroactive coverage, and protects rural hospitals by accelerating their funding and heavily restricting corporate extraction whenever federal rural health funds are involved. It's a huge deal. Furthermore, the legislation codifies a strict prohibition on medical debt reporting. This directly addresses the financial security of the average family, basically ensuring that your credit score isn't totally ruined simply because you got sick.
Now, what's really interesting about this slide is how the Act establishes a hard price ceiling on medical services, generally tied to 120% of the Medicare reimbursement rate. So what does that actually mean for you? It means the exact same healthcare item or service cannot become unaffordable merely because you're unlucky enough to be billed through a more expensive payer, hospital, or network. It enforces transparency and essentially outlaws those hidden billing surprises that squeeze so many patients.
Moving on to Section 3, breaking up healthcare monopolies. Separating conglomerates. Look, releasing the debt burden is absolutely crucial, but we also have to repair the underlying systemic issues. Over time, power has dangerously concentrated into these massive conglomerates. The Act views this vertical integration as a core problem. In our current system, a single corporate empire can own the insurer, the pharmacy benefit manager, the pharmacy itself, the provider network, and the claims platform, all at the same time. This creates massive conflicts of interest at basically every single link in the chain, allowing them to steer patients and hide prices. The POPULIST Act changes this completely. It says companies must pick one major healthcare lane to be in and fully divest the rest. And to be clear, this isn't just a polite suggestion. Healthcare conglomerates would be required to submit actual divestment plans and completely separate their verticals by July 1, 2028. This involves incredibly strict oversight by the Federal Trade Commission and the Department of Justice. We're talking severe penalties, escrow mechanisms for noncompliance, and even the appointment of divestiture trustees if necessary. It's a mandated hard repair of broken market competition.
Section 4. The Medicare for All transition, a universal guarantee.
So how does the system return power directly to the people? The answer here is a full transition to Medicare for all. Let's see how this builds over a very aggressive timeline, making sure nobody is left stranded. Fast forward to 2028, universal coverage for all children begins. And July 1, those healthcare monopolies we just talked about must be fully divested. And then, the big one,
On January 1, 2029, the full Medicare for All universal rollout takes effect for all residents of the United States.
The actual mechanics of this guarantee are incredibly comprehensive. The benefits package covers just about everything: hospital care, primary care, vision, dental, mental health, reproductive care, and long-term supports. There is zero patient cost sharing for covered benefits and absolutely no balance billing allowed. Instead of the endless friction of private billing, hospitals are paid through planned global public budgets. The plan is funded, in part, by modest premiums, which, as the legislation notes, are offset by the universal basic income established over in Title VIII of the Act.
Now, a massive part of this universal system involves finally reining in prescription drug costs. The logic is pretty straightforward. When the public is paying for medicine, the public should not be powerless against monopoly pricing. So, the Act mandates that the government negotiates prescription drug prices directly. It completely prohibits pay-for-delay agreements, those shady deals that keep cheaper generic drugs off the market. It heavily regulates pharmacy middlemen, and it even mandates domestic sourcing for target medicines, just to ensure our supply chains for life-saving drugs are resilient, not fragile.
Okay, Section 5. Expanding the medical workforce. Building public capacity.
Which brings us to perhaps the most vital piece of this whole puzzle. There's a quote that says, "Insurance coverage without doctors, nurses, pharmacists, aides, counselors, technicians, and support staff is only a card in a wallet." It's so true, right? Lowering prices and guaranteeing coverage naturally means more people will seek out care. But without the actual professionals there to provide it, the system would simply replace high prices with long wait times.
So the crucial point is that Title III treats workforce capacity as a core, non-negotiable part of the healthcare system itself. It aggressively expands the medical workforce by distributing additional, previously capped hospital residency positions. It also promotes these accelerated 6-year direct entry medical programs to train new doctors faster. On top of that, it sets hard minimum staffing standards for nursing homes to protect vulnerable patients, and it reallocates unused physician waivers directly to rural and medically underserved areas. All in all, Title III of the Populist Act presents a sweeping, fundamental redesign of how Americans experience healthcare. By aiming to release citizens from crushing medical debt, repair broken and monopolized markets, and return power to patients through a fully staffed, publicly funded universal system, it sets an incredibly ambitious goal. And it leaves us with one final, provocative question to really reflect on. Can America build a healthcare system that actually serves the 100%?
Release, repair, and renewal. We can have a jubilee in 2026. The United States can address its spiritual and economic debts by enacting the Populist Act. Learn more about this bright and bountiful future at votewithbrian.com.